my perspective, I find sleep aids to be a double-edged sword because, while you want to try to help the patient, and patients sometimes demand medications immediately because it's struggling. But then there's also cut both ways because now you might just have kind of covered or smothered the issue, so to speak, by letting them sleep and not actually addressing the underlying problem. And the second part I always find is that the side effects as well, the hangover effect, all the other side effects of the anticholinergic effect, and so on, and the cross-reactivity with so many medications. So, Dr. Ritvo, what do you do when you have a patient coming up to you and saying, "Oh, what's your sleep aid, or what would you use for my insomnia?"
Well, I think I do want to separate out one thing, which is when somebody has an acute trauma and that is disrupting their sleep wake cycle because the excessive cortisol. In those cases, using a sleep medication is definitely indicated. You want to restore somebody's sleep wake cycle. So that's the one time where I'm very apt to say, we've got to get you sleeping. We're going to give you something to sleep. And in those cases, it can be, a variety of different things. I think what you're referring to is long-term use of sedative
Mhm.
hypnotics. If you go back 20 years ago, everybody was taking Valium to sleep every night as if that was a normal thing to do.
Well, don't forget you to wash it down with the wine as well at night. So.
Yeah, exactly. Well, I guess you started at lunch or 5 o'clock or whatever, but yeah. And I think we're really becoming a lot more aware that, the body does have its wisdom. And if the body is malfunctioning, you're best to find out what's going on and address that underlying problem because it's usually a symptom of something else. It's not just standalone insomnia and I'm going to give you a little Ambien and things are going to be great. So I think, I don't have a favorite go-to medication because I really try to avoid that situation, except as I say in trauma or with, time change. A lot of people do travel. That's very taxing on the brain. So some melatonin can be helpful. Using, Ambien or something to get into the right hours can be helpful for that transition. But long range, no, we don't want to get into that situation. If somebody does need something for the long range, I really try to stay away from all the benzodiazepines because they are addicting and tolerance does build. So something like a hydroxyzine or over-the-counter Unisom, melatonin, magnesium, ashwagandha. There's all sorts of things that don't have that addiction potential that we can, start with some of those things. I personally like to recommend to my patients, get on YouTube, listen to quiet music, clear your mind before you go to bed. And then I think, one thing that is really important and really, really hard to do is good sleep hygiene.